Hi, I'm Sally King, the Director of Menstrual Matters. A few people have been asking me what is Menstrual Matters, what's it all about, and so I thought I'd give you a quick overview of our research aims. So these are the questions we hope to be answering with your help. So once the website is up and running in a couple of months, we'll have some web applications to help people check, track and then manage their health symptoms and how they might relate to either their menstrual cycle or hormonal medication. And we'll use that data, it'll be anonymised, and then we'll use it to answer these questions. So there are 10 questions. The first 5 are mainly about kind of the chemistry, what's going on behind the menstrual cycle and how it relates to ill health. And the second 5 are about clinical practice. So what's going on, why don't we know more about this topic already? So the first question is, can the menstrual cycle actually account for why more women of reproductive age, i.e. people in general who have a menstrual cycle, are affected by a range of chronic health issues? We're looking specifically at anxiety, depression, irritable bowel syndrome, chronic fatigue syndrome, migraine, asthma and perhaps fibromyalgia, which all affect far more women than men, so at least twice as many, if not 3 times as many. And I think for fibromyalgia it's up to 6 times as many women as men. And a lot of the symptoms of those chronic health issues are the same as or very similar to those of what we call premenstrual syndrome, which is a range of symptoms that people feel at certain times in their menstrual cycle. So we're saying that's not a coincidence, that there's some relationship here between the menstrual cycle, between the sex hormones and these symptoms of ill health. So we hope to use the data to prove any kind of pattern in terms of the number of people experiencing these issues. And then we would look into the kind of chemistry of this. So what is the actual role of the sex hormones, particularly estrogens and progesterone, in these health issues? So how are they triggering these symptoms? And then following on from that, is it the level of the sex hormone? Is it that you have too much estrogen? Is it the relationship between estrogen and other hormones? So how much estrogen you have in relationship to progesterone or testosterone? Or is it something else? Is it a secondary problem that's triggered by a changing level of sex hormones, for instance in dopamine, serotonin, cortisol, or adrenaline, or basically the stress response or other hormonal systems that might be affected by changing levels of sex hormones. And what makes some people very sensitive to this and others are fine without any symptoms. So some people get very ill on hormonal medication or through their menstrual cycle. Others are okay, or they might be fine on the contraceptive medication for many years and then suddenly start experiencing severe side effects. So what is it that's happening in the body to make some people feel very ill? And then how does hormonal medication in particular influence these chronic health issues or these symptoms? So we'll be looking at contraceptive medication mainly, but also HRT, which is the hormone therapy commonly given to women who are going through or have gone through the menopause, and also the hormone therapy given to people transitioning as transgender people. So that includes testosterone therapies as well as estrogen therapies in general. And then the next 5 questions that we're really looking into are about clinical practice. So what's going on here? Why have we ignored this topic, well, forever? And what can we learn about what's going on in clinical practice at the moment? So the first kind of question is about, can tracking your symptoms over time actually improve the diagnosis of the health issues? So for instance, can it help doctors and patients differentiate between chronic anxiety or chronic depression as an illness as opposed to one that is affected by or if not caused by their hormones? And the way to do that is to track those symptoms over time and see if there's a pattern. If there is, then we know for sure that there is some sort of hormonal influence happening. And this, of course, opens up a different way of treating those problems, but also a different diagnosis in itself. The next question is quite interesting. Is the process of tracking your symptoms actually beneficial to the patient in itself? So by tracking your symptoms, does that actually help you feel more in control of some of these issues, better able to predict and prepare for health symptoms? And so does that in itself boost well-being, but even does it reduce the symptoms? Then we want to sort of find out from you and from website users what treatment options or tips and tricks for managing symptoms work best. So each person has a different experience. For instance, I know quite a lot about managing nausea, since that was my problem for a few years. So I would share tips and tricks about how to manage that and what worked well for me, and as well as sort of pharmaceutical options for this. So which types of perhaps contraceptive medication might help with certain symptoms or could help in some cases to alleviate your symptoms. And then lastly, how does the menstrual taboo affect patient-doctor interactions, particularly during the diagnostic phase, but also treatment phase? So this isn't just GPs, it's when people might get referred to a specialist psychiatrist or a neurologist, perhaps even a gastroenterologist. What language are people using? How are they talking about the menstrual cycle? Because all too often in the past it's either been ignored or perhaps euphemisms have been used. For instance, is this a monthly problem? When in fact the question should be, do you think there is a relationship between your hormonal medication or your menstrual cycle and these symptoms? So that's it in a nutshell. Thanks very much for listening, and hope to speak to you soon. If not, keep reading the blog, and the website will be online in the next couple of months. Thank you. Bye.